What do you know about hypertension and how it's different from preeclampsia, post-eclampsia, or even eclampsia? And if you're not sure, that's okay. In this episode, we're going to break it all down and talk about why these conditions matter when we're looking at Black maternal health.
Research shows that Black women experience different medical conditions at a higher rate than women of other races. And one of those conditions is hypertension. And I wanted to see if you can explain to the audience the difference between gestational hypertension and all of the eclampsias, the pre, the post, the E. There's so many.
Yes.
And I wanted to take some time to go over those.
Absolutely. So sometimes people like to put gestational hypertension and preeclampsia in the same bucket. They are not the same thing. You can have gestational hypertension and not have preeclampsia. The biggest difference between the two is the presence of symptoms. So if you have gestational hypertension, all you have is an elevated blood pressure during pregnancy. Now, if you have preeclampsia, you will start experiencing some symptoms, whether that's headaches, swelling in your feet or hands. That can be blurry vision, protein in the urine, and also if it gets severe, it can also cause damage to your organs. So the biggest difference is the presence of symptoms. So that's why it's very important to go to all of your prenatal visits, because they can diagnose preeclampsia at your visit, especially if they're asking you to urinate in a cup.
Yes.
They're not trying to be annoying. They're just testing for presence of protein in your urine, which is a sign of preeclampsia.
So I heard you mention the importance of your prenatal appointments.
Yes.
Can you explain a little bit more about what else a provider would be looking for at that prenatal appointment to see if you are pre or if you're in eclampsia?
Yes,
and what is eclampsia?
Yes. So again, they would be looking for protein in the urine. That's one of the biggest signs of preeclampsia. Now, how we kind of discussed how if preeclampsia becomes severe, it can start causing damage to your organs. If it gets severe enough, it can turn into eclampsia, which now turns into pregnant women experiencing seizures and then possibly going into a coma. So eclampsia is essentially the severe version of preeclampsia. Now, it's also important to go to your appointments post-baby, because yes, now baby's here. It seems like you're just constantly going to pediatrician appointments, but you also still have to get checked up, because post-eclampsia is also very common. And you can have gone your whole pregnancy without gestational hypertension, again, elevated blood pressure or preeclampsia, but then you can develop post-eclampsia after childbirth. Post-eclampsia can occur due to many different things. The pain you're experiencing after childbirth, it can occur because our bodies are trying to return to our pre-pregnancy state. So all those blood vessels, they're working extremely hard to return to how they were prior to pregnancy.
Prior to pregnancy, were there any issues that you already had with blood pressure or hypertension?
Absolutely. I can say prior to pregnancy, I did have elevated blood pressures, which a lot of Black women do. We deal with stress, maybe not eating the best, not being the most physically active. So at doctor's appointments, when we get our annual checkups, I would experience that higher blood pressure. And because I knew I had that concern, I did want to do anything that I possibly could to prevent preeclampsia in my pregnancy. So what I decided to do was I did some research, and the decision that I decided I wanted to make for myself was to take a baby aspirin. Because essentially I did want to do anything I could to prevent getting preeclampsia and possibly going into preterm labor.
Okay. So for women out there, you would want them to talk to their provider.
Absolutely.
To see what is the best option for them, especially if they already have hypertension.
Yes.
And they don't want it to turn into something worse.
Yes, absolutely.
Okay. So talk to their OB provider.
Yes.
To see what they could do to help combat that.
Yes.
Okay.